We'll start the gluteal strengthening exercises with the bridge series. So we'll start by having your client lying on her or his back with knees bent about hip distance apart and feet flat on the surface, also about hips distance apart. Okay, throughout these gluteal strengthening exercises, we want to cue the client to activate her core. Engaging the abdominals can help correct that X pattern of tightness and weakness that I talked about in the beginning. It also helps to protect the lumbar spine from overworking during these exercises. Okay, so Lorraine, to start with, go ahead and pull your belly button in toward your spine to activate your deep abdominals. So your abdominals should feel firmed up a bit. Okay, and now tighten your glutes, your buttock muscles, and lift your hips up in the air, just as high as you feel comfortable going. Pause and then come back down and rest. I also want to make a note here that Lorraine is lying flat on the table without pillow support, and that is intentional. For the bridge exercise, having your head on a pillow can put a kink or too much flexion in the neck. So it's important to perform this completely flat without pillow support. And Lorraine, did you notice any pain or any stiffness with that bridge? Okay, great. Okay, let's do a couple more repetitions, starting with engagement of the core, activation of the glutes, and then the lift, pause, and then lower with control. Good, and again, lift with control, pause, and lower with control. Good, continue with slow, smooth, steady motion. Up, pause, and then down, and pause. Good, up, pause, down, and pause. Okay, go ahead and relax. I recommend shooting for 15 repetitions. It can be helpful to instruct your client to start with however much they can do. Make sure that their technique does not falter as they perform more repetitions. If they start to lose form, then stop them at that level of repetition. Have them continue with that number of repetitions for a few days until their strength develops and they're able to do more repetitions, maintaining good form. Also, one note about arm position. Having arms by the side is a perfect place to start. One of the progressions of a bridge is to bend the elbows. So go ahead and do that, Lorraine. Yep. So fingers are pointed more toward the ceiling. Yeah, good. And go ahead and again, start by engaging the abs, glutes, and lift. Good, and then go ahead and lower. Now the next progression is to lift your arms all the way pointed toward the ceiling. Good, and go ahead and lift, pause, and then lower. Good, and rest. Progressing the position of the arms to overhead further activates the core muscles. The next variation of the bridge will be a bridge squeeze. So using a small ball that is filled not quite to capacity. There should be a little bit of give in the ball. So let's put this ball right between your knees. Perfect. Okay, and now Lorraine, before you do the bridge, just gently squeeze on the ball here, perfect, and maintain that level of pressure, that level of squeeze as you go through the bridge. Okay, go ahead, yep, squeeze and lift and lower. And actually, yeah, you can go ahead and go back to having your arms straight. Perfect, and lower. Good, so glutes, abs, lift, pause, and lower. Good. Lift, pause, and lower. Continue just a couple more reps. Lift, pause, and lower, and rest. I also want to note that it can be helpful to match breathing with the movement. There are a couple different breathing patterns that are helpful. First, ask your client to inhale through the nose to prepare for the exercise. Go ahead and do that. Good. And then as you exhale through your mouth, go ahead and lift up into the bridge. Good, and lower. Okay, excellent. And then you would have the client inhale again. That works well for some people, but the exhale can be a little bit too extended for some people. So the other breathing pattern that's helpful is to alternate the exhale and the inhale during the bridge motion. So this time, Lorraine, inhale to prepare for the exercise, exhale, lift into the bridge, and now inhale as you lower, and then exhale as you lift, and then inhale, lower, exhale, lift, and inhale, lower. Good, and rest. So there is not one right way to breathe during the bridge. I suggest experimenting with the breathing pattern and see what feels best for you. Whether you exhale throughout the entire bridge and inhale on the rest, or you exhale on the lift and inhale on the lower. The most important thing is to be sure that your client is not holding their breath during the exercise. Breathing helps to calm the nervous system and to further activate muscles during the whole movement.
If you found this video useful and want to see more like this, make sure you subscribe below and don't forget to hit the notification bell.